I'm going to give them one more try.
Good morning, everyone. We're going to start the meeting of the Human Services
Got a big
Committee,
family in town.
and glad to see you all here.
Two of the board
And
members.
do we have a motion to accept the minutes of January 26th?
They're under. So moved. Does he
Thank
want
you,
to?
Darrell. And
See,
Paul
so
is
really,
seconding.
his personality isn't right.
Okay, and all in favor?
I know.
He's actually under them, technically.
He does think so.
We're going. We're live. We're live. Yeah. So we have a form.
Secondly, enroll in next meeting, so let me back in again.
Okay, thank you very much. And so that's passed, and we're going to go into department requests and reports. Tammy, did I see Tammy on here? Hi, Tammy. Good morning.
Hi there. How are you?
I'm great, thanks. You want to get started?
Sure. Yep. So I wanted to give you some updates on a variety of benefit programs. To pick up where we left off last month, I had asked for the agreement that it was okay to submit the rental supplement program, and I have done so. It was submitted with the focus being to assist individuals and families that are currently in receipt of temporary housing assistance. And within the plan, where it required that I provide more specificity, I said that I would prioritize for employable recent parolees in large families. I have not heard anything since submitting that. I honestly don't expect to for probably another month. Moving on, we also have been advised through the Office of Children and Family Services of a grant opportunity for new childcare providers who are opening programs. It's being dubbed as the Child Care Deserts Program. OCFS asked local districts to share this information widely. We have distributed a flyer, and we've highlighted the program and linked it to our portion of the county website as well. And we were informed by the Office of Temporary and Disability Assistance with an informational letter letting us know that the newly launched program providing, it's a federal connectivity program providing discounts of up to $30 a month towards the internet service for low-income families and a one-time discount in the purchase of a computer or tablet. We have heard some of these things in the past. Excuse me. Last summer, I believe there was a time where we were talking about the availability of that program through the to increase people's connectivity. And that is not something that we have ended up hearing much about here within our department. Hopefully it means that people's needs are being met. But I can send both of those flyers to Debbie to attach to the minutes if there is an interest for that.
Yes, please. Thank you.
Okay, will do. And the Home Energy Assistance Program, Heap, has extended the dates of operation for its regular and emergency benefit components to close of business on April 29th. Also, a second emergency grant became available starting yesterday. So now if people are eligible and have not received any grants, they would be able to get the original regular benefit and then 2 additional emergency benefits. Depending upon the heat source, those benefits range from $185 to $965. If, on the other hand, if somebody has already received a regular benefit and the first emergency benefit and now is nearly out of fuel or their heating source is in danger, they would be eligible for this second emergency benefit that is available. And another allocation related to the American Rescue Plan Act of 2021, the Pandemic Emergency Assistance Program. Because we love acronyms, they have that called PEAF, is allowing for a diaper payment and a multi-generational food payment. Households that are in receipt of temporary assistance or SNAP who have had a child under the age of 3 during the month of January of 2022 will receive a payment of $140. Households in receipt of temporary assistance or SNAP who have an adult age 55 or over, and at least one child under the age of 17 during the month of March 2022 will receive a payment of $730 per eligible older individual. These benefits are being sent directly to the electronic benefit transfer account of the TA or SNAP recipient. The estimated amount in total for Washington County for the diaper supplement is $45,080. And the estimated amount of the multi-generational food payment for Washington County is $67,160. So consistent with the process that is already followed by the state for issuing temporary assistance benefits, the local district has to front that money and then submit claims for the reimbursement of the payments. That will be 100% reimbursable, but it does bring us to the need for the resolution that I have on the agenda for to recognize the pandemic emergency assistance funding in the amount of $112,240, with matching putting it in the family assistance appropriation and matching amount for the federal aid revenue line. I'm sorry, I'm not able to speak clearly today, apparently.
You're doing great. No problem. So we need a motion to move this to finance.
Madam Chair, so moved.
Thank you, Daryl. And Dan seconds. Any discussion or questions for Tammy? Paul? Paul,
Yeah, Tammy, will these families be notified, or they have to somehow figure this out?
They are supposed to receive letters. Again, something that would be going directly to them from the state.
Okay, great. That was my only question.
Yeah, they have to open the letters and read them and understand them.
thank you. Any other questions for Tammy on this? Okay. All in favor?
Aye.
Thank you. Okay, Tammy?
And I don't really mean that very lightly either. I guess I should clarify, because I often am kidding, but I know that the letters that come around these programs are unnecessarily complicated, and oftentimes people may not even open them because of that. So I would say that if somebody appeared at a grocery store, for instance, and they would be able to see what the benefit amount is on their card. So if they are not aware of this coming, they should become aware of it once they're at that point, is my thought. And then I just have a couple of miscellaneous items. So I wanted to also follow up from last time where it was mentioned that I should have contact with Assemblyman Matt Simpson. So I did meet with him virtually yesterday. We discussed a variety of topics related to the budget particularly, and mostly as it related to foster care costs and situations with homelessness. Also, I'd been contacted a couple of weeks ago through email from Congresswoman Elise Stefanik's office seeking my thoughts on a bill that had been proposed relating to SNAP flexibility. A lot of it looked like it was looking to put into law a lot of the waivers, some of the waivers that had already been present during the pandemic. So I gave my 62 cents on that, and haven't heard anything since. So trying to get the information out to everybody that needs to have it. And I'm happy to have those conversations or answer any questions that anybody has.
Sarah, did I see your hand up?
Yes, thank you, Deb. No, I just want to thank you for reading through all that material, because you mentioned about the letters. Just when I was reading the emails, I'm really glad that we have you to interpret, distill down the mountains of information that's piled into that, because I was scratching my head, so I can imagine what the people who are receiving this are wondering, how do I interpret this information? So thank you.
You're welcome.
I did of that, Tammy. It's a lot. It's a lot. So we appreciate you.
Thank you.
Anything else, Tammy?
That's all I have.
Okay. Does anyone else have any questions? Okay. Okay, thank you. And we're gonna go on to, you see Gina on here?
I'm here.
Hi, Gina.
Good morning.
Good morning. Gotta find you on the screen.
Last month, I went before committee and asked permission to engage in a request for proposal process to expand our home care workforce by seeking out additional in-home personal care providers. After engaging in a discussion with county administration, it was decided that the RFP process is not really applicable to our situation at this time. So I would like to request a waiver from the RFP process and instead engaged in specialized outreach with the continued goal of increasing our personal care in-home contractor list.
So, that's a good plan. And we certainly need these workers at church supply. So you need a motion. Dan? Go ahead.
Yeah, thank you.
Second.
Darryl, second. Okay. And all in favor?
Aye.
Aye.
Thank you.
Gina?
The next topic is around Manchester papers. As you may recall, a couple years ago, I went before committee and asked permission to engage in an agreement with Manchester Papers for the production of the Senior Times quarterly newspaper. Since that time, the agreement that we have in place with Manchester Papers has expired. Given the feedback from our Washington County residents, we would like to continue producing a newsletter that reaches not only older adults, but also caregivers and individuals of all ages and abilities. This new audience would also, of course, entail changing the name from Senior Times to a more appropriate name to its information recipients. Given the volume of information that we have to share, we would like to produce an insert to an existing paper or a newsletter on a monthly basis instead of a quarterly basis. After meeting with the county administration, it was agreed that the service my department is seeking can be achieved through a 3-quote process. Based on this determination, I would like the committee's approval to seek out 3 quotes from local newspaper companies for the production of a monthly newsletter or an insert in a current existing paper for the ability, and also for the ability for our department to make a decision on who gets awarded the agreement based on the results of the quotes. My department at this time has this service currently in our budget, and of course, our goal is to stay within those parameters.
Madam Chair, so moved.
Okay. And do we have a second on that?
I'll second it for discussion. I have some
Okay.
questions.
Yep, thanks, Dan. And, okay.
You said it's in your budget for the quarterly now. Are you saying that you believe on a monthly basis insert, it wouldn't be any more expensive?
We have received a quote from a newspaper company currently, and that quote is within our budget, yes.
Okay, thank you.
Any other questions, Tammy or Gina? Gina, would that include the information that Tammy just gave us for seniors regarding like the Heap fund and opportunity to increase the SNAP funds?
Absolutely. So our overall goal, like the Senior Times, and also you may receive our monthly newsletter, is to try to gather as much current information from various providers, service agencies as we can, and put them all in one sole place for people to read.
Thank you. And they will simplify it so that people can actually get the information rather than
Correct.
their pages.
That's
Okay,
always
all in
our
favor?
goal.
Yes, thank you. All in favor?
Aye.
Okay.
Okay,
And the
thank
Google
you.
paper? Yeah.
Yes. After finalizing the agreement between our department and GoGo Grandparent Company, we started servicing the Washington County residents age 60 and older in mid-January. Because we started much later than we had anticipated, we are still gathering data on the program's effectiveness. The current agreement that we have right now expires March 31st, 2022. Due to our late start, we would like to continue piloting the program through March of 2023. After speaking with county administration, it was determined that given the unique and specialized services that GoGo Grandparent provides, it was determined that GoGo Grandparent is a sole source provider and that we can contract directly with them. At this time, I would like permission for the committee to engage in another agreement with GoGo Grandparent through March 2023 for senior transportation services for Washington County residents age 60 and older.
Do we have a motion to move this to finance?
I'll second that.
Okay. Dan, you have a question?
Yeah, will this cost be the same for another whole year?
Yes, as I shared in the past, they have different tiers of services. We engaged in the lowest tier, the low cost tier that serves 10 individuals a month. We do have the unmet needs funds in our budget to cover this cost, and unmet needs funds, again, is 100% state dollars with no local share. So we do have the ability to cover this program. We were hoping to have the program, honestly, implemented for a much longer period of time and see the effectiveness and look at possibly increasing the tier level. But given that we're still in the very beginning stages of the program, we feel it's appropriate to continue at the bottom tier.
Sarah?
Question, I guess, to the committee. If this is already in the budget and it's covered, we need to send this to finance at this point, or I guess it's more of a procedural question.
No,
Yep.
I don't think you do since it's already in the budget.
Okay. So we want to amend a motion to approve the contract?
Oh, to allow Gina to move forward with the process of sole source.
Right.
And if it goes beyond the budget, then she'll have to bring it back into finance.
Sole source is already described in our procurement policy.
So do we need a motion even?
I'll make that motion.
Okay, we have a second. Okay, all in favor?
Aye. Yeah, I just don't want to keep punting things over to finance.
It's lame. Okay, so.
I do have 3 other items, if you don't mind.
Not at all.
We received confirmation from Supervisor Nolan and Supervisor Fisher to appoint representatives for Fort Edward and Greenwich to our Office for Aging Advisory Council. At this time, I would like the committee's support to appoint Jeannie Mullen to represent Fort Edward and Gerald Felsch to represent Greenwich.
I'll make that motion.
Thanks.
I'll second that.
0 seconds. Any discussion? All in favor?
Aye.
Hey, Gina?
Thank you. The next item that I have is to share with you that March is National Nutrition Month. In past years, we've facilitated many festive in-person events throughout Washington County to highlight the importance of proper nutrition as you age. Some of these events included inviting local, state, and federal legislators to receive a tour of our central kitchen, to serve meals at our local sites, and we also extended invitations for individuals to ride along with a seasoned driver and complete a home-delivered meal route. With the COVID pandemic still amongst us, we are not able to celebrate as we have in the past, and instead are adapting our festivities. This year, we will be using our monthly newsletter and also using social media to highlight our nutrition program. So we just ask that you support us and follow us on Facebook as we celebrate the importance of National Nutrition Month all month long. Hopefully next year we can extend the invitation again for the kitchen tour and, of course, serving meals at the sites. And what's mostly enjoyed is the ride-alongs with our drivers.
Dana, that was a very special event, and something that we all miss and look forward to doing again because it was great.
Thank you. Thank you. And the last item I have is just truly to give committee an update on the unmet needs funding. As you know, and as I've shared at last committee, that we did ask for an extension for our allocation that we was given last year for unmet needs. Right now, plans are still under development. Given that these funds are truly focused to fill gaps in services, one proposed plan is to add an 11th route to our home delivered meals program. This 11th route is currently being serviced 1 day a week. Right now, the individuals receive 4 frozen meals and 1 hot meal. The proposed plan to add the 11th route would include serving the Putnam and Dresden residents with 5 hot meals Monday through Friday. The 100% unmet needs funds would then cover the cost of personnel, meals, and a vehicle. Of course, I will work with county administration and DPW for the vehicle piece. And that's all that I have right now.
Gina, do you need a motion to move forward on that for the 11th route, or are you all set?
I guess at this time, my objective was really to share with committee one proposed plan. If you feel it's appropriate for a motion to support the plan.
Gina, having gone with them on Meals on Wheels and knowing there's so much more that's happening than just delivering a meal. It's an assessment that's done. It's a social event, and I can't say how much this program is valued. So I can't imagine somebody only going 1 day a week. And I think that an 11th route would be, if I were Darryl, I'd be saying absolutely, bring them on.
Yep.
Absolutely.
I agree.
I say
Yes.
absolutely too.
Yes,
Yeah.
and most certainly, it's always been, given the fact that we have this additional funding, it's just a great opportunity to add that 11th route. And it's always been our long-term goal to make, to serve these individuals Monday through Friday. And like you mentioned, it's so much more than just a meal. It's really a health and wellness check. So if we can perform those Monday through Friday instead of just 1 day a week, and we have it in our budget to do so, why not?
Yeah, some of these folks, this is their only social interaction with somebody outside of their home, and generally they're living by themselves. So yes, this is welcome. Thank you.
Okay, thank you.
Okay.
Sue?
Yeah.
Sue? This
Yes,
is Cassie. I also wanted to point out to Gina and everybody else that the home delivered meals also is a benefit for those of us that are caregivers for the elderly that insist on living alone, because then we know somebody else is in there checking on them in the middle of the day when we can't. And that is an additional added benefit.
Yes, thank you.
There's no question about that, Cassie. Just opening up a prescription bottle, or, I've seen taking the garbage bag out. Just wonderful. It's a wonderful resource, and so it's a great addition. Yeah, Al?
Gina, just for clarification, is it one-time unmet needs money or ongoing unmet needs money?
Right now, we're being told by the governor that it is a continued funding source.
Okay, because I just wanted to clarify, we're building in cost of the budget with one-time money. That would be my only
Correct.
concern. Okay.
Okay, any other questions? Thank you, Gina. Do you have any others?
Thank you very much. That's it. Thank you.
Okay. And Mike? You see Mike Gray here? Welcome.
Good morning, everyone. I wanted to update you on a new program that was started at the beginning of past school year. That was the pre-PINS program that's funded through STSJP funding with 62% state reimbursement. And it's a collaboration with DSS to work with those youth that don't quite rise to the level of PINS behavior. And it's called the pre-PINS program. And I just want to update you on the numbers. We're about just over halfway through the school year, and business, unfortunately, is too good. We've had 36 total cases today, including the fact that we had to really stop receiving referrals about a month ago because we lost a staff member and we're just bringing someone on board. So I imagine that number is going to grow pretty quick. The referral sources, we've had 11 referrals directly from DSS, and 2 were direct family referrals to us, and 23 were school referrals. Now, those 23 came from just 3 districts. We've only opened it up, that's why we pilot this, to see what kind of response we've gotten. And I would say that the main reason for the referrals is from the schools, obviously, is truancy, and where the family's not responding to the school. We go into the household with twice a week, meet with the youth and the family, and we incorporate parenting education skills along to support the parent, which seems to be a pretty common issue among those that are truant. But the other referrals were for incorrigible behavior, disrespectful, internet safety issues, unsafe practices, substance abuse, and it's truly a collaboration between the departments in the sense that we have a steering team that meets every few weeks to discuss cases. It's a quick process, but I'm pleased with the outcomes. We've had 18 successful closures, and the cases can last 60 to 90 days. We had 13 cases that are still open right now. We had 1 unsuccessful case that we just couldn't meet their needs, and they were elevated up 2 pins. And we had 4 cases that were closed prior to the 60 days due to family moving out of the county, or 1 was homeschooled, and various the 2 other youth. I can't remember honestly why the cases were closed, but I'm very pleased with the outcomes that we're getting with the program, really helping families develop the skill and competency to address their own issues and accept the responsibility of getting their youth to school, and also learning tools to provide that structure and support that the youth need to develop in the right direction. So I'll keep you posted as we go forward, and if anybody has any questions on how the program operates, I'd be glad to answer.
Mike, right now you're open to 3 school districts. Is there a plan to open them to other school districts?
Yeah, yes, there is. Once I get the new staff person trained, we certainly will be opening it up. It's a real issue right now with I don't know if it's a COVID hangover effect of whatever, not being in school, but truancy is a huge issue with the schools right now. And I know that the districts are looking for support, so.
And how long has this been going on now? Has it been 90 days or?
Yeah, we started the program in September, so we've had 18 successful closures and 13 open still, and 1 was unsuccessful. And the one case I remember now, we had to not accept the case because the needs were so high. I mean, we couldn't meet the needs of the youth. So yeah, I imagine we wouldn't have any problem ballooning up to probably 50 to 70 cases without any problem at all. So.
Mike, are the referrals coming directly to you, or do they go through like a single point of entry?
Well, referral sources from us, they go directly to us, but they can go through DSS as a gatekeeper on some PINS cases. They can refer down to us. The schools are going directly to us, and the parents, the call can go, say to DSS might kick it to us, or directly to us. So parental referrals, we've had 2 so far, but I got a feeling that as we evaluate the results and we make a decision about going forward, I think that the cases will go up for parental support.
Great service, thank you. Tammy?
Yeah, I just would like to definitely pick up on one of the things that Mike said and bring that back around to Mike's credit and his foresight on this, working with the truancy population, that empowers the parents and throws out a lifeline for those kids. these are cases that would very quickly escalate to being called in to Child Protective Services under the guise of inadequate education, or, parent failing to get the kid there. So him having somebody in there providing some parenting techniques, having someone in that household 2 times a week is definitely more than we are capable of doing from social services, and certainly far better use of anybody's time than having a child protective report investigated against a family. Just want to, it's a huge service for the county.
Tammy, I had written that down on my page of, reduce the cost of CPS with the service, and it has a better outcome.
Yes.
Yes, thank you. Any other questions for Mike or Tammy on this?
I have 2 other things I just want to update the committee on. We have a lifeguard training class going on right now. The class is full. We're fortunate Hudson Falls has been very gracious opening up the pool to us whenever it's available. So we'll have 13 more trained lifeguards at the end of the week. We have another lifeguard training and recertification for any of your rec staff, any of your program staff that needs Red Cross CPR certification. That's going to be scheduled in April, the week the kids are out of school. So I'll keep you informed on that. And the last thing is the Governor's Youth Council, which has been in operation for 2 years now, where we have our member on the Governor's Youth Council, where there's a youth from each county in the state. There's 62 youth that report directly to the associations and New York State Youth Bureaus, who makes policy recommendations to the governor's office. Our representative is Grace McFerrin. She's a junior from the town of Greenwich. Her term ends the end of March. So I will be asking to open it back up and soliciting youth that may be interested in participating in the Governor's Youth Council. There's an online application that has to be done. The youth are vetted by the governor's office and OCFS, as well as locally. Our youth board makes a recommendation on who we want to forward, but we'll be opening that up probably mid-March, accepting applications. So if you have any youth in your communities or anyone in Washington County, please have them give us a call. We'll tell them about the obligation, time obligation, and the mission and the purpose of the council. So it's a good experience for youth that may have an interest in politics and policy, and they interact with youth from all over the state. It's a good process. I'm impressed over the past 2 years. So that's all I have right now.
Great, thank you. Thanks very much. Okay, any other questions for Mike on that? The government now? Okay, let's move forward on to, I think I saw KJ on here. Good morning, KJ.
Good morning. So I have a couple of things. The first one, we had an additional award for our COVID enhancement. We had an additional $1 million. So there was no contract yet. It's just the award was sent out. So we're just requesting the budget amendment for that to be used on that and put forward into our funding.
That's an easy one to do. Who would like to make that motion? Daryl?
I'll move it.
Okay. Do we have a second? Okay, Dan, any questions for KJ on this? Okay. All in favor?
Aye.
Thank you. Okay.
And I do have a couple miscellaneous, of course. The first one is our fellows program and stuff. New York State Department of Health has, of course, we brought this before about doing the fellows program to help strengthen the public health programs and everything. We've been approved for 6 fellows, a local coordinator and a graduate fellow. Danielle has so graciously gone through and done a grade and salary schedule and stuff for them. And we wanted to get the ball rolling and everything on that. Of course, everything will be covered under the program with it. It's over 2 years. Unfortunately, it'll be almost a year. July 2023 is when it ends and stuff, but there may be additional funding beyond that. But since Danielle has gone through, done the grade and the schedule, the salary schedule and stuff, we'd like to get moving forward on this. And Danielle, do you have anything else to add to that?
Hi, KJ. I have all the information if we want to move it to personnel to talk about it there. Basically, it's just asking to add the positions to the title by grade and create a salary for them based on the recommendation from New York State for that fellowship program.
Do we have a motion? Sarah?
Yeah, I'll make the motion.
Okay, and do we have a second on that?
Yes.
Okay, Dan. Any discussion or anyone, any questions? All in favor?
Aye.
Aye.
Okay. Okay,
Yeah,
thank you, Dan.
And I'll do just a few quick updates and stuff for you. Our last public clinic that we're doing out is at Whitehall School. That'll be on March 3rd. That's going to be our last big clinic and stuff that we have out there. The numbers certainly have been decreasing for vaccination clinic. We will continue to do them in our office weekly and stuff. They just need to call, make an appointment with that. But that we'll be wrapping up using the VAX team from the EMS team and stuff. They will be doing that last clinic. The weekly ones are done in our office with the nurses. Our homebound program for vaccine clinics, that's wrapping up. That should be probably just about done by the end, by the 1st of March. The scragglers that we get in will do on a one-on-one basis instead of having a full day for them. So that's wrapping up. These are all good reports that things are wrapping up anyways. We are continuing to do some testing in-house. We really have not had a lot of response and stuff. It's scattered. But again, that is as they call, we're setting up the appointments and doing it for them. I did speak with Mark Spezio, who is doing the testing down in the southern part of the county and stuff. And I know their numbers are decreasing as well. So we're looking at contracting a lot of things. The people can still report their positive home test. They just have to go onto our website and then we upload it to the state system and everything. And that also has been decreasing. So also another good thing. Our positivity rate was 4.7 as of 2/22. And our last 7 days, for the last 7 days, it's 5.1. So it is steadily coming down. Unfortunately, our vaccination rate still isn't moving too much on the dial for that, but we'll see what else. Thanks to Office of Emergency Management, Public Safety, we are able to hand out test kits. We've been handing out test kits. They come into the office to get. We've handed out about 16 to 20 that we've done so far. And just one last thing, I know this has been a hot topic and stuff with not having to use the mask in the county buildings and stuff. If they come to public health, we still have to have masking on for it because we are in Article 28. So that is considered that we have to still have the mask. So if you come over into our building, the masks are in use. Any questions on any of this? Yes.
Sarah?
Have you cleared your calendar for March 2nd?
Have we cleared the calendar for March 2nd? I'm not sure why.
No, have you cleared your calendar? Your presence is requested at the public safety meeting.
Oh, I believe that meeting is March 1st, isn't it, Melissa? Is it March 1st or March 2nd?
I got the dates wrong. It's okay. It's March 1st.
I sent an email to Tina as well as Teresa.
Okay, thank you. I'm sorry I got the dates wrong. I'm going to confuse you. So it's public safety.
So you can recall. You may be right for the wrong reason.
Well, we might have to, extend
March 2nd.
I was going to say, but I would be more than happy to show up at the meeting on March 2nd instead. That would be great.
Please, we will need technical expertise to have a conversation based on fact.
So,
KJ, the, masters are required also in the judicial, area too, right? Or are
Pardon?
they, in the courtrooms, are they are still required there? Building seats.
That would be, yeah, that would be under their courtroom stuff. That would be under, that's their decisions on that and stuff, what they have to go through. You know, we have to go because we are a healthcare entity.
Thank you. Keep up the good work.
Thanks.
I'm glad it's happening a little bit. Any other questions for KJ?
Thank you.
Okay. And do we have any other business out there? Like, we're good and we can adjourn. Thank you very much, everybody. Keep up the good work. Have a good day.